The spread of the coronavirus has pushed the pause button on one of the world's biggest economic powerhouses.
We're coming on the air at this hour with breaking news there. Wall Street ending one of the worst weeks of trading since the financial crisis in 2008.
We're starting to get to that point where those supply chains are going to have massive disruptions.
When the world was first hit with SARS almost 20 years ago, it caused an economic blip, mostly for China and its neighboring countries. But at the time, China's gross domestic product was only 4% of the global total. It now stands at 16%, making China the second largest economy behind the US. One major driver behind China's economic rise was its massive network of factories, which churn out everything from t-shirts to mobile phones for consumers all over the world. Today, China makes up a third of world manufacturing and is the world's largest exporter. Decades of globalization have created supply chains so deeply interconnected that when there are issues in China's economy, it's felt across the globe.
We're in a situation where China, the shutdown in various factories and other places of work has meant that China isn't producing various bits that may well be vital inputs into production in other economies. So that is causing ripple-through effects around global.
They tell Nani your side it's unclear when the East will see case numbers peak, but the benefits of stay-at-home measures and social distancing are evident. Health experts say those efforts should continue to keep COVID-19 from spreading, especially with the holiday weekend ahead.
Frankly, the need for and the desire for all of us to be with our loved ones, to celebrate our religious beliefs, but this is not the time to congregate. And so we really want to just reinforce that congregation and groups of people is not the way to express that love and desire.
He's the Director General of the World Health Organization. Dr. Ghebreyesus has the most important job in the world right now. His agency is in charge of the global response to the coronavirus pandemic. Ideally, it should be the WHO's response that should dominate the news. But it's Dr. Ghebreyesus who is in the headlines, and that too for all the wrong reasons. The Wuhan coronavirus is now a pandemic. It did not have to be. Almost 1 million people have been infected by it. The number could have been much smaller. The virus could have been stopped had China taken timely action instead of orchestrating a cover-up. China failed to contain the Wuhan virus. The world is paying the price for it now. Where does the WHO Director General come in the picture? He had a role which he did not fulfill. And now there is a big question mark over his credibility. Since the beginning of this outbreak, he has defended China. Not just defended, he even praised China. Is he blind to China's follies? Or is he turning a blind eye to China's actions?
So far, around 20 workers have died trying to make it home.
With 1.3 billion people under lockdown, millions of migrant workers who survive on a daily wage are stranded in Indian cities. Last week, hundreds and thousands of them began walking towards their villages. Some are calling it one of the largest migrations in modern Indian history.
Now the United Nations is warning the coronavirus crisis has put the world on the brink of a hunger pandemic. 265 million people could face acute food shortages by the end of the year. That is double last year's projections. CBS's Deborah Patta has more.
This is what hunger looks like when it spills over into the streets. A food stampede in Kenya's largest slum, leaving scores injured and 2 dead.
These short-term protections might reduce the damage the economy suffers, but this pandemic could last a long time. Europeans and Americans are also being helped by unprecedented government responses.
Hasta 200.000 millones de euros.
£330 billion.
$2.2 trillion in urgently needed relief.
China's neighbour, North Korea, has cancelled all tour groups coming in for the Lunar New Year. Scientists are recommending that nobody travels to Wuhan. This is the city where this outbreak started, and they're also saying people shouldn't leave that city. That's a city of 11 million people, and they're suggesting during the Spring Festival, the most important festival in this country, that people shouldn't be coming and going from there.
To Clark. So this was our only opportunity to go home in time before the shutdown.
I've developed mild symptoms of the coronavirus, that's to say.
Is mocking Joe Biden for using a mask as a, quote, prop. What are those two diverging statements?
Can attest that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do. But be in no doubt that I can continue.
One thing is clear, China is coming ever closer to Europe's doorstep. NATO allies must face this challenge together. The head of the military alliance has urged the West not to ignore China's growing military might. He says that Beijing's expanding stockpile of nuclear weapons is capable of reaching Europe, and he's demanded a stronger response.
A mistake is a mistake. But if they were knowingly responsible, yeah, then there should be consequences.
Testing on a small number of people has been underway in Russia for less than 2 months, and there's been no scientific data made public on any of it. Nonetheless, from Vladimir Putin today, a stunner. Russia, he said, has approved the first vaccine for the coronavirus infection. Nicknamed Sputnik V for Sputnik vaccine after the Russian space satellite that in 1957 beat the world into orbit. Russia even put out this video today referencing the namesake. But there are myriad questions and concerns already.
Many of us will know that Africa is extremely vulnerable to the ravages of this virus.
In order to counter COVID-19, we need vaccines, effective treatments, and fast and reliable tests.
It will ensure that desperately needed resources for research and development of new vaccines, therapeutics and diagnostics are made available so that we can overcome this disease.
We need to develop a vaccine. We need to produce it and to deploy it in every single corner of the world and make it available at affordable prices.
We will stand by our partners in this common endeavor, and you can count on Italy. Together, we'll make it.
We must commit to a system of fair global access, because as long as the virus is active somewhere, we are at risk everywhere.
But ఈ మనం ట్రీట్మెంట్ ఇవ్వలేతే ఇవన్నిటిని కూడా మనం అడ్డుకోవడానికి ఆస్కారం ఉంది.
ముఖ్యంగా ఇలాంటి రోగులకు మనం దగ్గర ఎటువంటి ట్రీట్మెంట్ ఇస్తున్నాం సార్?
ఇక్కడ ఫస్ట్ మనం ఏం చేస్తామంటే ఇట్లాంటి రోగులు వచ్చినప్పుడు ఇమ్మీడియట్గా వాళ్ళకు ఫిజికల్ ఎగ్జామినేషన్ చేస్తాము. ఫిజికల్ ఎగ్జామ్ చేసినప్పుడు ఏంటంటే వాళ్ళకు ఫిజికల్గా అన్నీ బాగున్నప్పుడైతే ఆటోమేటిక్గా మనము కొన్ని ఫ్లూయిడ్స్ ఇచ్చుకోవడం కానీ కొన్ని ఇంజెక్షన్స్ ఇచ్చుకోవడం కానీ చేస్తాం. ఎందుకంటే ఈ పేషెంట్స్ ఆహారం కూడా సరిగా తీసుకోరు, ఆ మాల్ న్యూట్రిషన్ ప్రాబ్లమ్స్ కూడా ఉంటాయి. సో దానికి తోడుగా విటమిన్ డెఫిషియన్సీస్ కూడా ఎక్కువ ఉంటాయి. సో వాటిని మనం
in a period of time where we have no visibility. My conviction is that we should cancel all events. Absolutely.
So that brings you
worldwide.
Through
worldwide.
June 1st?
Absolutely.
Okay.
Why? Because when I observe, I'm not an expert from the World Health Organization, but when I look at what is happening, the peak of coronavirus in China.
We heard from the Bavarian regional prime minister announcing the cancellation, and he said this is an unbelievable shame. The authorities in Bavaria describe Oktoberfest as the biggest and most beautiful party in the world. If you've been, you may disagree with the last part of that description, but in all seriousness, this is huge, not just for Bavaria, but for Germany. A lot of tourists come to this event. 6 million people were expected in Munich for a few weeks that festival runs for this autumn. It brings in well over €1 billion to the local economy. So to have to cancel it is a massive deal, not just for the region, but for Germany too. And I suppose it's an indication, isn't it, that whilst we are seeing some elements of daily life coming back to normal, it is going to be a very long time.